Oh, no, I don't.
Chair
think
Montes
that's
Anderson,
true.
Senator Barr, no, let me talk about, that was actually the next thing I was going to talk about was the overpayment situation. The simple answer to your question is no, I think if in fact we're able to, when we finish reconciling those overpayments, if to the extent that there are amounts that were in fact overpaid to CCOs, unless we determine that there was some documented decision based in law with some kind of an agreement or something like that, that we should be able to recover those dollar amounts. But the problem is more complicated than meets the eye, and at the risk of driving you all mad with detail, I want to illustrate that for you a little bit in this case. First of all, we've heard the number $74 million and that $10 million has been recovered. And those are both numbers that were from OHA documents that were released as part of a public records request and that the media reported accurately, and those were, in fact, what those documents said. Both those numbers are almost certainly wrong as we go to reconcile them, and they're wrong for a number of reasons. They're wrong in total, but they're also not the number that necessarily relates to CCO overpayments. Let me explain. Whatever the total number ultimately is, there are two things that feed that number. One is this notion of a capitation rate that is potentially too high for a dual eligible, someone who's on Medicare and Medicaid. Medicare pays first, and so the CCO should get less money per member per month for those dual eligible members. And so there's a dollar amount, and that's fairly straightforward. However, there's also buried in that same problem an issue of what match rate did we claim from the federal government? Did we treat them all as ACA expansion population at 100%? Or were they, in fact, a mix of different eligibilities that have different match rates, which, in fact, is the case? And so there's a piece of that that also is simply on OHA for the exposure related to the match rate. To make it even a little bit more complicated, people got health care in some significant number of cases from their CCO and not from Medicare. Well, that means Medicare actually owes us money. And so you actually have to go in and figure out how to reconcile all of those things before you can get to a real answer of what is the problem, how much is it, how much is in which pocket, and how do you go about reconciling that and reclaiming money from CCOs to the extent that that's a portion of the total. In each of these, if I could just real quickly, in each of these problems, they tend to be at least as complicated as that. And so when it looks like we're sitting around saying, yeah, we got a problem and we'll get back to you, that's kind of the nature of the excavation work we're trying to do to get to where we for sure understand what we're talking about, what the dollar amounts are involved, and what the right thing to do is.
So